This session is a Meet the Experts panel session. My name is Alischa Ross and I'll be facilitating today. But most of the talking is going to happen from the pardon me, three panellists. We will have our third panellist joining us shortly. But we are really blessed today to have the experience in the room that will be shared with you from these wonderful people that are sitting up here with me. So it is a great pleasure for me to introduce to you Lady Roslyn Morauta. My apologies.
No problem.
Former First Lady of Papua New Guinea and Chair of the PNG Country Coordinating Committee for the Global Fund. And sitting next on our panel is a man that I do know very well, and thank you for being here with us, is Professor Rob Moody. Now, Rob has been many different things over the years, and one of the things that I think he'll draw on today is actually part of his role as the Inaugural Director of Country Support for UNAIDS and his work in public health. And just in time, thank you very much, very pleased to welcome our third panellist, Steve Kraus, who is the Director of UNAIDS Regional Support Team for Asia Pacific. So please give a round of applause for our panellists. So this session is about the recipe for effective public health, innovation, leadership and grassroots mobilisation. What does that mean? Well, what I'm hoping, and I say this to all of our panellists, what I'm hoping that we can bring up in our discussion and debate today is what are the ingredients? What are the extra ingredients that we need to really frame effective public health? Public health that works on the ground and public health that works, at the top end as well. And I know that you all have experience working at that grassroots end as well as working in some large agencies. So I hope that you'll be really candid and give us some insight into those experiences. And to kick things off, I'm going to hand over to Rob and invite Rob to tell us a little bit about how HIV and AIDS has really changed our approach to public health.
Thanks, Ali. Thanks for the opportunity of being here. And I've actually talked a little bit about this before, and I'd had it. The response to HIV and AIDS is unprecedented in 8 respects. And I've just changed that to 9 respects now. And maybe every time I do this, I'll realise there's something else which is different about HIV. I don't do much work in HIV now. I spend most of my time either teaching or working on alcohol, tobacco, food-related diseases. And that's why it's been so interesting to come back in this conference and the pre-conferences and be immersed in HIV, the world of HIV again, because I think one forgets how different this is. Our response to HIV has been and continues to be, and there's so much actually from HIV that we can learn in other things that we're doing. First of all, I mean the rapid scientific breakthroughs. More was learned about AIDS in the first decade than maybe about other diseases in a century. And even in the last 3 years, we've learnt more about, and I'm quoting Steve now, more about HIV than in the previous 10 years. So the sort of exponential capacity to increase our scientific knowledge is quite outstanding. And there's a reason for that, which I'll come back to in a minute. AIDS has unleashed a public mobilisation that we've never seen before in terms of policy responses and in terms of resources. It's also established a whole new raft of AIDS organisations, both in terms of funding and program. UNAIDS, which I was at right at the beginning. We'd never had sort of a UN organisation to bring the other organisations together. The Global Fund for AIDS, TB and Malaria, the International AIDS Vaccine Initiative, UNITAID. Again, this we'd never seen this before, and we probably won't see it again for quite a while. We're trying to mobilise resources around non-communicable diseases, and people saying, no, we can't do it again. So it's quite interesting. Perhaps the major hallmark of the response, I think, has been the engagement, activism and role of people living with HIV. I mean, we haven't had people living with TB. We haven't had people living with malaria. We're just starting to see people living with cancer who are really becoming active and are bringing their issues to the forefront. We don't have people who have suffered road trauma. But we have had people living with HIV who are both affected or infected. And that's had a profound effect on policymakers, on researchers. I had the privilege of interviewing Françoise Barré-Sinoussi the other day, and I said, why has there been such dramatic or such level of resources in the science? And she said part of that's due to the community mobilisation. If there had been no community mobilisation and community response, then the drive around the science would not nearly have been as strong. So that partnership, in a sense, has been incredibly important in HIV. Another aspect is, for the first time, high-income countries have used public money for long-term treatment in low and middle-income countries. We hadn't really, by virtue of development assistance in health, mostly been around prevention, mostly been around vaccination, immunisation, but not around direct treatment. Yet we've seen the value of PEPFAR, and I take my hat off to George Bush for this. We've seen the value of obviously of the Global Fund and the drivers of that to provide resources for treatment. It is one of the most political of diseases. It's a tough disease for politics, for politicians, because it's related so intrinsically to sex and to drugs and what are defined as sometimes illegal activities, and it does take brave politicians to confront it effectively. That's not only in HIV, but it's certainly a trickier problem, particularly around sex and around drugs, and we're still seeing that. We had yesterday a discussion with sex workers, with gay men in Africa, and everybody talked about criminalisation, talked about the role of the law in defining their lives and their activities. Three other aspects, and these I pay tribute to a former boss of ours, Jonathan Mann, who in many ways I think is one of the most significant figures in public health, certainly last century. And AIDS has been conceptualised and understood as a human rights issue. And he really introduced the issue of health and human rights. And the fact that we should, those of us in public health, should understand health in a different way. We need to have another perspective on it, not just the sort of epidemiological perspective that we're so used to. It's also been our foundation for developing, I think, for really developing our understanding of global health. And the special program on AIDS, which was established in WHO in 1985, very quickly became, under Jonathan's guidance, the global program on AIDS. And it was certainly the first time, in my view, that we'd really started talking about global health, and that this is something that we all share, rather than being, oh, that's a problem of developing countries, this is a problem of high-income countries, blah, blah. This is something that is about our own globe, and we need to respond to, both in terms of geography and in terms of a global response. And lastly, which I had never written down, and it really fits in, and I take my hat off to because it talks about 4 pillars: treat, reform, educate, and love. And it's this last one of love, which you doesn't often get mentioned in terms of public health. And again, Jonathan was the first person I'd heard really talk about love as part of a force for public health good. It's not often talked about as that, but it is incredibly important. And I guess we've seen, the damage of hatred and ego by virtue of the downing of MH17. We see so much of that, yet there are enormous forces for good, and love is an incredibly important part of that. And I think that has really underpinned so much of the great things about the response to HIV.
Thank you, Rob. I was so pleased that you ended on that last point of love. I've heard it raised in a number of forums in the last few days as the conference has begun, and I think love as a catalyst for the work that we do in public health is so essential that we remember, from great leaders like Jonathan Mann, but also many that are here in this conference, in this day, in this time, who are picking up on that message. If we can share that a little more, I think the world just actually will be a better place. So thank you. It's now a great pleasure to ask Ros if she would share with us, perhaps bringing it back down from, the global health perspective and actually bringing it back down to take a focused look at a country level and to share with us your expertise and years of dedication and commitment in working in Papua New Guinea. And I think what we'd really like to understand is what has happened in the last decade. How has the health system in Papua New Guinea changed, and how is that affecting people living with HIV and PNG? Thank you, Ros.
Thanks, Ali. When Steve asked me to speak with he and Rob today, I said sure, until I received from Ali the more information, and I saw this meet the experts. Well, please, I'm not an expert. It'd be quite fraudulent for me to present myself as one. But I've been working for a long time with HIV and PNG, and I hope that experience will make up for my amateur status. I also thought back to ICAP in Melbourne. We were coming to Melbourne to meet, and I thought back to ICAP and the pivotal role that ICAP played in building the national response in PNG and other Pacific countries. I really don't think we can underestimate the importance of that. A very conservative foreign minister, Alexander Dana, but somehow he got what was needed in the region, in Asia and Pacific, in relation to HIV. And supported by Michael Wooldridge, again very conservative politically, but quite a progressive health minister. And it's quite extraordinary, the impact that I think ICAP had. For the first time, many leaders from the region were brought to the ICAP conference in 2003. And honestly, it was the first time these presidents and prime ministers and health ministers had ever met a positive person, ever learned really facts about the disease, and started to realize what impact it might have on their societies and economies. So it's great to be back in Melbourne, and I hope, as Mark Dybel called it this morning, the Melbourne moment, that this conference too will lead us to quite a new place in HIV. So I thought back to 2003, and what was the PNG health system like for positive people then? And what's changed? And I think it's fair to say that the change has been revolutionary. In 2003, there was no treatment available in public health facilities at all. There were just a handful of people who were on ARVs, the drugs being brought in privately from overseas at great cost. Very few doctors knew anything about HIV medicine, and the general health system knew nothing, apart from the fact that the medical wards in the major hospitals were filled with AIDS patients. The leading cause of death in Port Moresby General Hospital at the time was from AIDS-related illnesses. The following year, in March 2004, the government, the health department, supported by Asian Development Bank and WHO, began a pilot project in just 4 centres, 2 government ones and 2 Catholic health facilities, to start treating people. By the end of that year, we had 320 people on treatment. And then came the Global Fund, which was the other absolutely revolutionary thing as far as positive people in PNG were concerned. By the end of 2012, we had over 87 ART sites in all 20 provinces of the country, with over 13,000 people on treatment. And these figures place PNG as the third highest in treatment coverage in the Asia-Pacific region. Officially, it's 79%. Probably it's a little bit less than that, but nonetheless, the figures are really impressive. And then think about that achievement in the context of Papua New Guinea. More than 850 languages and cultures. The terrain, massive mountains and valleys, far-flung island communities, very few roads in the country. the cost of getting services to people, the low rate of adult literacy, less than 60%. Think of the massive training of health workers that has gone on to achieve this testing and treatment program, the planning, logistics, and the money involved. The achievement is all the more remarkable when you look at the health system in Papua New Guinea. We spend only $150 per person per annum on health. Very, very low. Many rural aid posts are closed. We have an aging health workforce not being replaced at sufficient rate. Maternal mortality is the highest in the region, with 733 women per 100,000 live births dying in childbirth each year. 60% of women bear children without supervision of trained midwives or at a health facility. Half of all children are not immunised. There's one doctor per 17,000 people. Fiji has 20 doctors per 20,000. Australia has one doctor for every 300 people. So, we have a very weak health system, yet we've had these astonishing results, really, for people living with AIDS. So, in this context, how have we managed to roll out over 400 VCT sites and 87 ART clinics? Through the sheer determination and dedication of individuals. It really does come to individuals who just don't give up. In the health department, the National AIDS Council, the mainline churches have to be mentioned, especially Catholic, Anglican, and Lutheran. Churches in PNG provide probably 50% of the health services, almost 50%, and the mainline churches have come on really well. The nuns dispense condoms. They treat with great compassion anyone with HIV. It's, the official line of the bishops is just ignored and they get on with it. The public launching of IGAT Hope in 2005, which is our umbrella organisation for positive people, really did help the cause. And a small group of people living with HIV just didn't allow the bureaucrats to give up. At the same time, we've had enormous technical and some financial support from WHO and UNAIDS, and huge amounts of money from the Australian government, the Global Fund, and the Asian Development Bank. Finally, the PNG government has chipped in with money as well as human resources. For the last 3 years, the government has procured all ARTs, that's no longer donor funded, all test kits and other essential commodities. And slowly we're trying to get the government to absorb all the positions that have been funded under the donor programs into the public service structures. This is quite complicated in PNG because health is a provincial function. We have 20 provinces, so you're dealing with 20 governments and 20 public services to integrate people back into. So that's the good news, but it's not all good news. Treatment rates are low for children, less than 35% being started on treatment. And while almost 80% of adults who need treatment have received it, retention rates are very worryingly low. Some sites have reported dropout rates as high as 25% after the first year, and overall, we think that probably only 45% of people are still on treatment after 60 months. What's causing this? It's a combination of factors. The cost and time of getting to ART clinics, especially outside Port Moresby and Lae, compounded by occasional stockouts of drugs. People get to the clinic and then no drugs, and they may have spent a lot of money and time getting there, so of course they become dispirited. We also have a very big problem with some churches, the Pentecostal revivalist churches, who actively encourage people who are positive to stop treatment, just telling them that God will cure them. And this isn't helped when there's a general, with the low literacy rates, general lack of understanding about health and disease and modern medicine, with a corresponding influence of sorcery and other traditional beliefs. most Papua New Guineans, you don't have a major illness or die from natural causes. Someone has done something to cause this illness or death. And this affects health in PNG enormously. It's not just in relation to HIV. We have the same problem of drug adherence and abuse of drugs, lack of adherence and improper use of drugs for TB, malaria, and in fact for all diseases. And as a result, we have growing problems with drug effectiveness, probably one of the biggest challenges, I think, in PNG today in public health. We can no longer use chloroquine for malaria. We have very alarming rates of MDR TB growing and resistance to antibiotics. Every corner store sells one or two amoxicillin to anyone who wants to buy them. And people pop them regularly to treat a cough, cold, headache, or minor infection. The other not good news is that we've missed many opportunities to improve the rate and effectiveness of HIV diagnosis and treatment. While concentrating on this major effort to expand services certainly got things moving, their limited integration into mainstream health has resulted in missing many people who should have been diagnosed and treated, people presenting with TB, with STIs, and women coming to maternal and child health clinics. Just to give you some examples, only 60% of women accessing antenatal care receive HIV testing. Last year, only 24% of people going to TB clinics had an HIV test, despite the known very high co-infection rate, and only 12% of those who attended an STI clinic received an HIV test. Health services, particularly outside Port Moresby, are not necessarily user-friendly for many positive people, especially for men who have sex with men, transgender people, or sex workers. So the stigma associated with HIV and the discrimination and exclusion, particularly of some key affected population, are still a huge barrier to accessing services and providing appropriate services. So, you know, if I look at where we need to go, the future focus of the treatment program has to be on consolidating the start we've made by improving the quality and the range of services. The focus has to be on integrating HIV services into the general health system, particularly with TB, STI, and MCH services. The third priority, which I related to the first, is to mobilize peer networks of all positive people more effectively and forge partnerships with service providers to improve access to services and reduce stigma. And finally, to advocate more vocally on the role treatment has played in prevention. And it takes me back to 2003. Only 2 positive people came to ICAP from PNG in 2003. There was supposed to be a third, and she is actually here today, but she was prevented from getting a visa in 2003 because she very honestly filled her visa application form for Australia, and when it said, "Have you had TB?" she ticked yes. And so she was denied a visa, but she's learned how to get over that one now by producing chest x-rays. Yeah, she got over TB. But the other 2 women are also both still alive and well. One is living in a village in the Southern Highlands, not featured in the Oil Search film that you may have seen, but living a life very much like the women in that short documentary. And the other one is remarried to a guy who's now president of the Positive People's Association, and they have a 4-year-old little girl. So to me, they're the living examples of effective leadership in HIV. That's what it takes.
Great.
Thank you, Rose. I was, particularly just really felt the sheer size of the challenge that you described, not as somebody who has ever immersed myself in the culture in PNG or many cultures. I particularly also was held by your emphasis on perseverance. I think we've all, and everyone's nodding, and I think we all have felt as well as witnessed that in our own experiences. Just the sheer determination that it often takes to really make that difference, to pave those roads. And I know that you will have many stories of that, and maybe some more will get shared today. And lastly, the other comment I just wanted to make was how valuable it is to reflect on where we've come from, you know, so that we can actually take time occasionally and reflect on the journey and also the achievements in that time, to help us really understand what we have to do next. And I really appreciated that. As someone who has spent 14 years working in the youth side of things, it was actually at ICAP in 2001 that the regional youth movement really found its feet and really carved a platform. And we were lucky to have the leadership. You know, Rob was co-chairing that conference, and people that were willing to listen to I think it was 2001.
Yeah.
Sorry.
The health promotion was 2002.
Yeah. But, you know, and that's what I hope comes out today, is it really, you know, there's a lot of questions where people are saying, you know, why won't this agency do more, or why won't, you know, this particular stakeholder, you know, spend money there? But actually, it's as much a right as a responsibility that we, you know, really persevere to create real change. So thank you. It was very moving as well. And it's a great pleasure now to introduce you to Steve, who I think is going to pick up on something that, if you've been around the conference, you will have heard being talked about, and that is ending AIDS by 2030. Ending AIDS by 2030. You know, it's pretty amazing that we're actually even saying that. You know, this really has been the first international AIDS conference, I think, where we've been prepared to start to use those sorts of phrases so boldly and so clearly. So I'll hand over to Steve to talk to you about what that means in terms of transforming the global sustainable development agenda. Thank you.
Great, thanks Alischa, and good afternoon, everybody. I'm very impressed. I tried finding this room yesterday, and it wasn't easy, but a lot of you found it, so good on you, good on you. Well done, well done. And I also applaud you, because if I had a chance to go to a meeting called Recipe for Effective Public Health, I'd kind of like, that sounds a little fringe. and so I think it's great that you come and that we have this opportunity to join and share together. So thanks for that. I'm going to keep my comments kind of quick, because I'm kind of keen also, and I'm sure both Roz and Rob are keen to have all of you a chance to talk and share some ideas. So let me jump to the chase. I think this is great. When I worked at UNFPA, we were fortunate enough to have an executive director at the time who didn't always feel comfortable on some of the issues on sexual and reproductive health, but loved young people and was absolutely convinced that the future was going to be determined by bright young people stepping forward and claiming their right to development and sustainable development and participation in the global economy and the global good governance. And that's exactly what's happened here. When we started all of this kind of stuff, and I look at how it's moving and going forward, and you're blowing as strong as the wind. I mean, it's going all over the world. It's like no one can stop that. And it's like the wind, it just blows where it goes, and we have young people all over the world taking on incredible leadership. So I just really applaud you, and I want to, you know, for what it's worth, I'd like to offer 3 ideas for the post-2015 development. It goes without saying, it's just mere arithmetic. Rob, who is a very dear friend, and Roz, another very dear friend. For us, the post-2015 development agenda is very important, but you know what? It's your development agenda. It's the young people's development agenda. It's the world that you will live in. It's the world that we will live in too, hopefully, if we continue to enjoy good health. But fundamentally, it's the world that you will grow into adulthood and raise your children and raise your family, be with those that you love and care about, and the world that you live will be determined by these events that are taking place today and over the next, well, really over the next 18 months in terms of that global dialogue. So what are my recipe for success? I'm going to begin right where Rob left off and where you have already clearly identified as a key ingredient for success: love. I've got a bunch of academic degrees, not as many as Rob or perhaps as Roz, but I tell you, in my public health training and in my international tropical health work, We learned a lot about epidemiology. We learned a lot about fancy words. A lot of times they come in three, like sustainable national development, all those kind of things. But in fact, the most important word is love. It's love. And I think, years ago, it was 1981, I was working on refugees, working with Vietnamese boat people, Khmers, and Lao, highland, lowland Lao, in Thailand. And part of the situation in 1981 is we had actually hundreds of thousands of Vietnamese boat people arriving in southern Thailand by escaping out of Vietnam and going by boat into southern Thailand. And in southern Thailand, a lot of times, in that journey, a lot of the times women were raped, a lot of times men and women and children were burnt to death and beaten up by pirates in the sea. And when they arrived in southern Thailand, a lot of times they were on the edge of life. And there was a gentleman, Suchart, who was responsible for our programming in southern Thailand, and he would work as a Thai citizen, as a Muslim in Buddhist Thailand, working with the local health authorities to provide protection and health for those Vietnamese boat people. And I asked Suchart one time, because he would get up at all times of the day and night, and go and meet with government officials, governors, the village leaders, talk to the immigration authorities, to the police, and he would insist on providing care for these people. And I said, Suchart, why do you do that? And he says, Steve, he said, he said, I have one litmus test for what I do. And he says, if this was my son or daughter, and I couldn't help them, what would I want somebody else to do? And I tell you, that phrase of Suchart has impacted me in all of my professional career. I think of the mothers and fathers, if I couldn't be there for my son or daughter, gay or straight, lesbian or not, rich or poor, selling sex or not, mentally healthy, mentally ill, in a detention center, in jail, poor, struggling, on the street, drug use, whatever, a migrant, physically disabled. If I couldn't provide support, what would I want somebody else to do? And that's the way to go. And I think that's probably not preached enough as a public health fundamental, but it's certainly preached in all the world's great religions. And this passion for caring for another individual. And yes, of course, we go to school to get smarter and educated and degrees and all of that stuff. And as we walk the road of life, we pick up other important life skills. But I think the core thing that it really, if it never changes, is this fundamental commitment to love one another. Now, I think when I look at a person like Ross, I think Lady Ross, First Lady of PNG, there's no reason why Ross had to get involved in the HIV/AIDS response, really. That wasn't necessarily in her portfolio, but she chose to do that. That was a personal call, a personal commitment. Same thing for Rob. I can say easily, the best boss I ever had in the UN system, and I've had a few, is the best guy. The best boss I ever had. Why? Because he chose to love his team as opposed to intimidate and fear and, I know more than you and I told you to get that report ready by tomorrow and today's today and it's not ready. No, none of that stuff. It was this commitment to loving and to being a person with compassion and understanding. So I'm not telling you anything you don't know. I'm just simply affirming what you already know. And don't let anybody ever tell you that you got to throw that out the window, that's old-fashioned. That is still a winning formula for the post-2015 development agenda and for the challenges we face today. If there's a Melbourne moment, that's a nice phrase. I love it. Let it be the moment of love. Second point, I think it's so important that as we walk the road of life as lovers, we are always willing to take a risk. I think when you love, then at any moment it can be an easy event, but at any moment it can be really dangerous and risky. And it can put you at the edge of like saying, I'll keep loving, but I think I'll just take a time out here. I think I'll put it on hold until tomorrow morning and come back to it when it's a little bit cooled down. I mean, when you see injustices, when you see opportunities that aren't being met, when people have the right to health, when they have the right of agency, the right to participate, the right to benefit from social progress and technical advances, scientific advances, the right to education, and you see those rights aren't being met, it's a risky adventure. In some of our countries, in some of our local communities, it's a bit of a risk, and in some places, it's actually a death threat. And we've heard about those events this week. We heard that from Chief Justice Kirby on Sunday night about people who have literally died because they loved and they choose to take a risk. Others of us have had the opportunity to take a risk, and sometimes that's meant changing our employment. Sometimes that's meant having voters not being real popular with the Premier's office. Sometimes that's meant for a Minister of Health to speak up. But it's also, I'm sure, it has also meant that sometimes maybe your parents, sometimes the people that you work with say, wow, this is getting a little too far. It's going farther than I want. But we have this opportunity to love and then to take the risk. And I love that. Then the final point, love, risk, and I think the third is the courage to keep doing it. Keep loving and keep taking risks requires courage. Because we will get hammered. I can tell you just recently, I got screamed at, hollered at by somebody who's really important in my life, who's important in my UN career. Well, he happened to be wrong, but at any rate, I had to have the courage the next day to say, hey, I'm sorry you had a bad hair day, but you know what? We're going to keep doing what we're doing, and you can't chase me away because you can't chase the issue away. And I tried to do that with love, not like, bop him in the face, but to keep having the courage to know what you know is right. And, tenacity, I say tenacity wins 95% of the issues. If you just hang in there and have the courage to keep fighting. Look at all the people we admire today. Nelson Mandela, who we've heard several times a quote. Not easy for him. He loved, he took risks, and then he had the courage to keep going. Martin Luther King, some of the, a person who I grew up with. And I grew up learning of his death by a family member, not an immediate family member, celebrating that some black person had been shot, and that was going to help America. But the idea of that, that you have to have the courage to just keep going when all around you looks so bleak. And when somebody says, well, sex workers, they violated the law, God damn it, they deserve to be in jail. I mean, it's the courage to stand up, to speak truth to power, because that never changes. That courage, truth to power. And maybe I'll just end there and say, when I look at leaders, when I look at people who love, risk, and courage, I think of this guy, I think of that woman, and it's great because we are not alone. We're not alone. You always find people who are willing to walk the road with you. And that's a good thing about love. The more you love, the more you find others who are loved. The more you risk, you find others who are going to stand with you. And the more you take courage, you find some really brave souls. So with that, I'd like to say thanks. I also want to acknowledge Phil Silverman. He's another guy who loves and takes risks and has courage. Phil is one of the key pioneers, I'd say a global pillar in the HIV/AIDS response. Phil, for many, many years, championed the Elizabeth Taylor Fund and worked with AMFAR and did some of the most innovative, daring, risk-taking, courageous work in San Francisco and the world when it wasn't so easy to talk about HIV. Thanks.
I'm not sure what you say after something that is that moving, but I felt a lot of love in the room as you were talking, that's for sure. And actually I do. I want to share this story because I have some strong and long standing heartfelt thanks, for all of you, but particularly Rob, who has been a mentor in my life for a long, long time. And I'll channel myself back to being a young woman. I think probably I was just in my early 20s, and I had managed to make my way to New York. And I reached out to Rob and I said to him, I walked past the UN today, it's so exciting. I know you used to work there, you know people there. Can you introduce me to somebody? I would love to meet somebody who works for the United Nations. I was so excited by that idea as a 21-year-old. and Rob connected me with Steve. And my knees were knocking. I was thinking, I get this opportunity. I'm 21 and I'm going to meet a director of a UN agency. I was really nervous. And you know, the thing that I actually remember about that meeting was you said something to me that day that you just said again this day about what a great boss Rob had been. And you said to me, when you go back to Melbourne, give him this for me. And he gave me the biggest hug and said, when you go back to Melbourne, you give this hug to Rob for me. And that's a moment of love, and I always remember that. And that struck me, and I walked out of there with such a different thought about the people in the positions of leadership in those agencies and actually just how real they are, and they are run by people. So I just wanted to share that story. Thank you. But importantly, I hope that we have some questions from the audience. I'd love to invite any of you that have a comment or a question. We have microphones. Everyone seems to be on this end of the room. There's 2 microphones, one down the front and one further up there. Do we have anybody that would like to ask a question?
And I want to salute our youngest member up there.
Yeah, baby.
Just how
Yes.
nice it is to have you here. We had
And
Good
behaving
afternoon.
perfectly.
exactly.
Good afternoon, everybody, and thank you so much for the panel for that information that you've shared with us. I just have a comment, not so much of a question. Yesterday, after the plenary session in the morning, I was a bit very low-costed. I felt very down, and one of the reasons for that was I kept asking myself, how ready are we, as everybody who has come to this conference, to accept the status quo of what's happening on the face of the fight against HIV and AIDS in the world? And you know, you come to conferences like this, people are sitting, and there's a lot of issues that are being addressed from different directions. But one of the questions I had to ask myself as sitting there in that big room was, are we ready? Have people really asked themselves personally, have we really done some self-introspection, whether we are ready to accept people the way they are? And I'm talking about, especially about the key population, because it's a new group, a new topic, not new group, a new topic really that's coming up. And to be honest, I don't think people have really asked that question to themselves. It's more like, you know, people should answer, it's people's issue, but as long as it doesn't affect me, you know, I'll just go on with my daily work. And having heard Steve today and sitting there again today, I said, you know, you attend so many sessions and so many discussions, and it's all about graphs, you know, it's all about information. It's very scientific, you know, but the whole heart-to-heart element of addressing HIV, it's never really at conferences like this. So for me, Steve, what you've done to me today was just remind me again that the heart of any working with the heart of addressing any public health issue really does start with oneself and asking about your own self, how ready you are to really make that impact. And also not only that, but doing it with that love. Because anybody that works with this in this sort of field, success will only be successful as a result of love and, like you said, risk. And you know, taking those risks. And what was the third one that you've mentioned?
Courage.
Courage as well. Yeah. So for me, I just wanted to say thank you. It was really a self-reflecting moment for me, and it just makes more meaning. It brings more meaning to this fight of HIV and AIDS. Thank you very much.
I think that's a really good point. You know, we know there's fashion in the HIV industry, and the donors all want us to focus on one thing one day and another thing the next day, and we're not always looking at, hopefully we are looking at what the epidemic is really like in all of our contexts and addressing that. But I just want to share with you how important that question is. I'm on the board of of Anglicare PNG, which is started it's now becoming the social welfare arm of the Anglican Church, but started just as a little organization called Stop AIDS. We only did HIV work in the beginning, but now we're branching out into many other things. But we've been forced to address this. And, you know, on our board, the Bishop of Port Moresby is our chair. We have 2 other representatives from the Anglican Church. And I would say everybody else on the board comes from a relatively conservative background. I would be seen as by far the most radical person. And probably all quite involved in their own churches, not all Anglican, but in some way involved in churches. And our director and I have been trying to get the board to understand that we have to change the focus of our work in HIV to make it far more inclusive for sex workers and gay men and others who... We run a very big clinic, STI clinic, as well as a treatment clinic. And we've got to open up more. And it's been quite a struggle, but we had to, everyone asked themselves that question, and it was really interesting. It was only through talking it through and talking more about the nature of the epidemic, particularly in Port Moresby, where our clinic is, that everyone has come on board. And they don't want us to stop working with other people, but they've realized the absolute importance of including everybody and reaching out to these people. And it's a question we all have to ask ourselves all the time, because you're right, not everyone is ready to take it on.
Hi, my name's Ashley, and I run a refugee health program in Tasmania. And I work for probably one of the biggest organizations in the world running this program. And I applied for a scholarship to come here today because I represent some of the most vulnerable people you'll meet. And as part of my scholarship, I said that I would carry on this message through social media. So I had approval 2 weeks ago, or when I accepted the scholarship, that I would pass this message on. And what I found is that the biggest barriers have been the barriers that my own organization has set up for passing on the message. And I wonder how you overcome those barriers when the biggest barriers are actually within your own organization.
Mr. UNAIDS?
Yeah, Steve.
Go for it, I'll comment.
Well, I mean, all the great advances in public health are 3 Ps: persistence, persistence, and persistence.
Yeah.
And maybe 4 Ps.
Yeah.
And you know, working outside the system, working inside the system, never giving up. I mean, it is...
Never giving up.
You just keep at it and at it and at it. And you build relationships with others that can help sustain you. And just coming back to our previous point, actually, you spend time looking and nurturing your own emotional, physical and spiritual health. I mean, if we want to be generous to others, we have to be generous to ourselves. And often we forget that. We're saying, oh, well, we'll just work hard for other people. We forget to work hard for ourselves as well. So, I mean, looking after yourself to give you the strength to keep going, and then working out those other networks to eventually build enough of a coalition that you do actually start to impact the organisation. And if you keep hitting your head against the wall, sometimes you just have to move on. You know, you do have to change. If you can't affect change, you try and try and try. You move on, try from other organisations, other perspectives.
Yeah. Well, you know, that's great advice. I couldn't agree more. And quite frankly, the only thing I would add perhaps to that is a little bit what Rob said is persistence, 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 the 3 or 4 Ps. And then the 5th one, which he talked about, was people. Find the people that will nurture and support you. And it may be that you start with 1 or 2, but it's this kind of, Rob uses this phrase quite a bit, it's shared leadership, and this idea of that finding those out there who will also champion, giving them the space to show their leadership. My daughter, who's a whiz kid, and then she makes me look like a super father, but one of the things she's had to learn in the last couple of years, she's 18 now, but she had to learn to kind of make space for others to also be good leaders. Because as president of her class, you know, she could be the president of the class and always do everything. And so she had to learn to create little spaces, other spaces for other peers to come on board and say, hey, next week we have the student assembly. I've given the talk the last 3 times. How about you? And then you create the space, But I'm sure that that's not unique or new to you. But I think this idea of shared partnership, giving people a chance to, if they say something in public, a lot of times then it's harder for them. A good friend of mine, Dr. Han Toon, who's now recently passed away, but was a Burmese medical doctor, he said, Steve, in the UN, there's only 2 things you really got to do. You got to, first of all, get governments to say the right thing publicly, and then secondly, hold them accountable. And then, and I thought that was good advice. And so sometimes I think it's good to create a space to let some of your, even senior managers, put them on a place where they have to say the right thing, and then hold them accountable. Thanks.
Hi, so I'm wondering if your answer may end up being similar for my question, but I wanted to pick up on some of the successes that you spoke of having occurred in the HIV/AIDS space, particularly in such a short time space, and ask you, for someone who doesn't work in HIV, I work in NCDs, the new epidemic, what do you think we can learn as the future leaders from the success of HIV/AIDS?
Thanks. Because we're really trying to figure this out at the moment in terms of what can we learn and what can we apply in this field. I mean, one of the reasons why I talked about people living with HIV, we don't have people living with stroke or with heart attacks or with obesity or, often issues that are really very stigmatised, and yet we haven't learnt to bring the human face to this at all. And I was just reading a recent report from WHO about the next global report, and my suggestion was, for goodness sakes, put in there some comments from people that actually are affected or by these issues to bring the human face to it, because at the moment that we don't do that. I think there are. NCDs is not a great, you never start advocating for something that begins with non. So we have a sort of image problem, but we've got to work out where the common areas are with other groups, I think, to work out, because it's just not a whole lot of new funds. We've got to work out how to maximise that. One of the big areas actually that is missing at the moment is the big international NGOs, the big, they are, the CARES, the World Visions, the Red Cross is a little, but the Médecins Sans Frontières, when you look at the extent of the burden of disease, then the response is nowhere near adequate. It means, they're working on a whole lot of other issues, importantly like HIV, but we need to get them, because they're the ones that often change the dynamic within the bilateral agencies who are providing a lot of the new funds. We need moneyed leadership. We have Gates and Bloomberg who are doing funding something in tobacco, but the funding in tobacco is 113th the amount that goes into HIV, and yet the burden of disease is way more actually. But I'm not saying ever to say we should be doing less than HIV. I'm just saying we spent $1.5 trillion on the arms industry, for which we've just seen MH17 blown out of the, so these runaway industries. We do have the money. It's a question of how we allocate. We do need to stand up, speak, and keep speaking. That's a fundamental, and refine our messages, get better at lobbying, get better at representation, and we have to fight some of the industries really strongly. In HIV, we haven't really had to do that. We haven't had to fight the sort of sex industry or the drug industries, tobacco, alcohol, junk food industries. They're lining up for us.
Well, I think I might actually start back at this end of the panel, and we're pretty close actually to wrapping up. So what I would love is if you might just have some closing thoughts or remarks
just really to reiterate the whole issue about effective leadership in health. I wrote much more than I presented today because I wasn't quite sure. I thought we were going for nearly 2 hours. So. But my second paragraph was this. What makes effective leadership in the response to HIV? Persistence, not giving up. trying to involve anyone and everyone, building partnerships with government, with churches, with NGOs, with private companies, making the case whenever and wherever, making sure the funding continues, listening closely to people living with HIV, trying to ensure that they have a say in their own destiny. And I think that's the key.
Wow, perfect. Wow. That's a good way to do it. That's perfect.
Rob, do you have some reflections for us?
Well, again, around the issue of leadership, I would encourage us all to give each other the permission to look after ourselves, so that I'm sure the more emotionally intelligent we can be as leaders, the more emotionally well and healthy we are, the better that impacts on everybody else, and the better it impacts on I think, ultimately on people's health and well-being. We have to be the sort of people that we want others to be, and I think we do need to give each other permission to be looking after ourselves.
Great. I think Roz, her second paragraph there that she's just read to us, that's perfect. That's a perfect way to end this idea of partnership. Rob's saying make sure we take care of each other, and I just say keep loving. Thanks.
Well, thank you all. What I'm very proud of is actually that this dialogue took place in this conference. It's so easy sometimes, I think, for health conferences to talk only about the science and health and what you do to fix someone's health when it goes wrong. You send them to the doctor, or you give them pills, or you treat them, or you bandage them. But actually what we've done today is, I think, transcend that in our dialogue, and we've talked about the holistic part of health, which is about the people involved in health. So I just want to thank our panellists for that, and I really do hope, and I've written that down, that if there is a Melbourne moment, let it be a moment of love, and I think we had one of those in the room today. So thank you all very much.